I'm here.
Hello. Okay, can you see my screen?
Yes.
All right. Let's finish up. So the patient, if they have active TB and they happen to be in the hospital, what is considered airborne precautions? So what do we do?
We wear the N95 and we put them in a
Negative pressure.
air pressure. Yeah.
All right.
Isolated.
What happens if we have visitors?
We ask them to follow the airborne precautions.
So what mask do they wear?
The N95.
Have the patients been, have the visitors been fitted for the N95 mask?
Wait, sorry. Does the patient wear it?
Let's answer my first question first.
No, they have not.
No, they haven't been fitted.
No. So can they wear the N95?
No.
No, because we don't know what size they'll have, right?
Right.
All right, second scenario. What is the, what if the patient has to leave the room? For
They have to cover their mouth or they have to wear the mask.
what mask do they wear?
Droplet.
I think they have to wear the N95 mask because they will be
Has
fitted
the
for it.
patient been fitted?
They put a regular mask
think
over the
they
patient
wear
to transfer the patient between.
So a regular droplet.
Okay,
The surgical mask.
so if a patient has to leave, the patient has to wear a snug-fitting surgical mask. Hey, show me what you're doing here. Good night. Okay, go. Thanks. Love you. So they'll be, when they have to go to, for testing, for instance, whatever, they have to leave the room, the airborne room, negative pressure room, then they have to wear a snug-fitting surgical mask. Some of these may be in, let me see if this is mentioned in chapter 27. Okay, let me leave this 609. Let me see if this is in chapter 27. No, it's not. Okay. Well, I tried. All right. Next question is, what about the family members? Because like I was already saying, this patient won't be staying in the hospital for the entire 6 months, right? They'll only be probably in the hospital for 1 to 2 days, and then after that, they'll be sent home. So what do we do about the family? Isn't the family going to be
They need to be tested for
all
TB.
right? Very good. So that's all we do. Chances are, have the family been exposed already?
So then
Yes.
their duration
Oh,
would
they-
be 5.
Yeah, most likely. So the patient's family most likely have been exposed to him already. But we still just need to test these patients, the family members, I mean.
So their duration though would be 5, right?
No, 5 is only for HIV patients, immunocompromised patients. So they will be
Even
at
if
10.
you're living in the house with someone who has active TB?
Um, most likely, yes, a 10.
Oh, okay.
Mhm. For okay, another question is, okay, when can they return to work, or when are they considered no longer contagious? All right, so those are really two separate questions. So one is, when can they return to work, and when are they considered no longer contagious, because the employer will require a different standard. Okay, so if they before they can go to work, they must have 3 negative sputum cultures, but these sputum cultures are taken every 2 to 4 weeks. So let's say we go with a minimum 2 weeks, so we start treatment today. When can I submit a sputum sample?
2 to 4 weeks from the day you start.
Okay, let's say 2 weeks from now. So today is March 24. So 2 weeks from now will be April 7. So on April 7, I test their sputum again. If that's negative, fine, we continue with the treatment. 2 weeks after, so that would be
April
April
21st.
21st. Okay, April 21st. So I submit another one, and then 2 weeks after April 21st again. So once I have 3 consecutive negative sputum results, then the patient's no longer contagious, they can go back to work. But the important thing again is to continue taking the drug therapy. Until then, do I have to put them in a negative pressure room?
Yes.
But there's discharge in 1 to 2 days from the hospital.
Is
We
it
don't
just they
have a negative
wear a
pressure
surgical
room at
mask?
home. Sorry?
Do they wear just a tight fitting surgical mask around the house
For how long?
until they're clear?
Okay, this is the other one. So they are no longer contagious and can take off the mask after they've been taking the drug for at least 2 weeks, 2 to 3 weeks, and there is clinical improvement. Again, so these are two conditions here. You've been taking the drug therapy for at least 2 weeks, and there is clinical improvement. All right, and then they can take off the mask. They don't need to observe precautions anymore. They still have TB though, but they are no longer contagious. So they have to stay with the drug therapy. What would be a consequence if they don't complete the therapy?
There'll be a reoccurrence.
Not only that, what will you do to the bacillus?
Expose the rest.
It'll because of the fact that the drug was already in the system, it'll like make it'll there's a word.
Replicate.
No, it'll like it won't take that medication anymore. There's a word. Oh my god.
Resistant.
Resistant.
Okay, right. So you will
Okay.
develop a drug-resistant strain of the bacteria, and it'll be harder to treat. Plus, they'll have to start the treatment all over again, and possibly will take longer. So you, again, it's the purpose is not to scare the patient, but it's good enough of a what is it, motivator, right? That if you stick with the therapy, that's all you do. We hit this once, and then you're all good, right? What if you have a very reluctant patient and absolutely refuses? This is America. I'm free to do whatever I want. Can't force me to take that drug. So what do you do in that case?
Is the patient no longer in the hospital or the patient went home?
Yeah, the patient's homeless, an IV drug user. What can you do? This is America.
Don't you still keep them in the hospital if they're non-compliant? After you contact the CDC because of the fact that now that it would be communicable if he goes out into the public and spreads it.
Okay, exactly. So if the patient is a danger to society, then this is where the police power of the CDC comes in. So you know how they can quarantine entire communities or an entire city? They can do the same for these people. So temporarily, they will have to be involuntarily committed until they comply with the treatment. But we've never, at least in my experience, I've never encountered these. If it was handled, properly in the first place, so a social worker would be assigned to this patient, and that's their job to really educate them and then make sure they comply with the treatment. Again, people like that will be placed under directly observed therapy, and that's it. Let's see. Okay, let me discuss our calendar so far. So we have already postponed our tests. Technically a week, right? Because we were supposed to have it last week.
2 weeks because it's postponed today to next week.
No, I thought it was supposed to be on the 17th.
It was supposed to be last week.
Yeah, okay. So it's supposed to be last week. So technically it was postponed a week, right? No, it'll be 2 weeks because it'll be next week. Yeah, you're right. Okay. So I'm not really entertaining the thought of dragging this another week. In fact, I already uploaded it to Jupiter on Juno. So unless they change it, I'm planning to give it on Juno.
What's Juno?
Jupiter.
Oh, Jupiter. Okay.
Yeah, it's called Juno on Jupiter. It's a separate function. The name technically is Juno. So unless they change it, plan to take it on Juno, just like how you did for your exam tonight.
Okay.
Were
How
you
many
comfortable
questions?
with that though? By the way, were you able to go back to a previous question, or this only
Yes, we could
forward?
go back and forth. Yes.
Okay, so if it's Juno, you can go back. However, if it's another test software, you'll only go forward.
But if we're not sure about our previous answer, we can't go back and check them.
If it's another software, but on Juno, yes, you can. But if it's another
But
software,
on that one, on the one we took today, the professor said he selected the option for that, for us to be able to check our answers or something like that.
yeah, exactly. So that's what I just told you. But if it's another software, that one, because they're considering ExamSoft, and that one only goes forward. Okay, just like the NCLEX. You can't go back on the NCLEX. So that's tentatively on March 31st. So that means we'll have a short class afterwards, and then I'll still plan on giving you quiz 3 on April 7th. Again, the coverage for quiz 3 will be only pneumonia and TB. The quiz is also already on Juno. So I'm ready. Only the final isn't on uploaded yet. So on week 13, April 7, after our quiz, I'll proceed with cancer. Chapter 21 and part of 22 should be finished on April 7, and then I'll wrap up cancer on week 14. And then I can entertain questions if you have any based on your notes for the final exam.
Professor Scott, can you just confirm the chapters for next week, please?
Okay. It is 33, a little bit of 33, and 35, 36. 36 doesn't include the aneurysms. You know that, right?
Yeah, I know.
Okay. And then 64.
Got it. Thank you.
Up until did we do hypoglycemia? We did, right? Yeah, up until
Yes.
hypoglycemia. Yeah.
Professor, this is a 50-question quiz for next week, right? 50 question exam.
Yeah.
Okay.
Then 10 points for the quiz on April 7th, and then 75 for the final. So these are good times.
Thank you.
How much time do we have for the test?
70 minutes is the standard time. If you have accommodations, it will be time and a half.
Professor, is it okay to leave the chat? I'm supposed to start work soon.
Actually, we're technically done. I'm dismissing everybody already.
All right, thank you.
Thank you, Professor. Good night.
Good night.
Good night.
Night,
Alright.
Professor.
Good night, guys.
Good night.
Yeah, wash your hands, wipe from back to front.
Front to back.
Professor, I had one question. I was
Yes,
waiting.
Lois.
With latent TB, if the patient refuses to take treatment, it can potentially become active?
Yes, very good question. But unlike active TB, they're not contagious because they don't have symptoms. So
Okay.
technically, you can't force them if they refuse treatment.
I know, but if they don't receive treatment, does it become active?
Yes, there will be.
Okay.
There will come a day, that you develop something that will cause the immune system to be lowered, and that can come without warning. And at that time, you will have TB.
Okay.
Okay, it can activate your TB, and you'll have active TB now.
Right. Okay.
The best way really is while you're well, why not treat it?
Yeah, the thing is, when I was at clinicals, I had a child that had latent TB, and he was not taking that medication. He was spitting it out and everything. So that's why
Oh, okay. They can.
he was fighting.
Yeah,
Yeah.
there's really no need to force. I mean, they can wait unless the pediatrician is really concerned if the patient has risk factors. But kids are, they don't have decreased immune system, so I don't think it was really necessary.
Got it.
That's my
Okay.
opinion,
I
yeah.
got it. All right. Thank you.
Yeah, but the danger there again, if there will come a time, you get old or you develop something else, and then it will be activated.
Okay. Got it. Thank you.
All right.
Okay, so next week, do we log in here first and then you guide us to the exam, or
Well, I'll
we'll
let you
wait
know
to hear from you?
ahead of time.
Okay. All right. Thank you.
All right. Don't forget your case studies, your Saunders, and yeah, that's it. Case studies and Saunders.
Professor, I
Done. I
sent
think
the last of mine, the last 50, I emailed them to you.
Yeah, I think I'll work on them tomorrow.
Okay.
Okay, good night.
All righty.
All right, good night.
Thanks, professors.
Good night, Professor.
Okay,
Good
good night.
God you well. Stay safe and healthy.
Okay, Dr. Goodyear, bye-bye.
Bye-bye. Good night, sir.